And she's hoping that coming forward is going to help other women make more informed choices about their own health.
So how does a woman begin to find out if she has that gene? And does every woman who has the gene need a double mastectomy?
Well, to help answer these questions, we are joined by oncology genetics risk counselor Laura Rebek. She is from Columbia St. Mary's. We appreciate you being with us this evening. This is fascinating research. First of all, Laura, how does a woman find out if she might have this gene?
Well, the best first approach to finding out whether or not you have the genetic mutation is really to see a genetic counselor. Really, investigating the family history is the best first approach, because not everyone who has a family history of breast cancer would need genetic testing. Really, only about 5 to 10% of breast cancers will actually be hereditary. So through the genetic counseling process, we determine which patient should have genetic testing and kind of go through the process of what to expect with the test results and how they can impact their medical management.
Are these tests expensive to have?
They are, unfortunately. You know, it depends on the family history. You know, if someone has a family member with a known mutation already, then we can do a more simplified test and just look specifically for that mutation. If we don't have that information, then the test is several $1,000s. I will add, though, that most insurance companies do cover genetic testing.
Oh, do they? Okay, well, that's interesting. Now, Laura, does every woman who has this gene, do they need to have necessarily a double mastectomy?
They don't. It's a really personal choice, and there are a lot of options available for women who have a BRCA mutation, and so going straight to surgery is not their only option.
What are some of those other options then?
So heightened screening would be one of them, meaning in addition to a yearly mammogram, we'd also recommend a breast MRI, and we'd space those out every 6 months. So they're being screened at 6-month intervals, doing self-breast exams, having their doctor do clinical breast exams every 6 months. And there are medications that are used that can actually help reduce breast cancer risk as well.
And I would imagine a lot of your work, Laura, is emotional counseling to help the women, or, you know, when they find out something, then they have to deal with the psychological ramifications.
Right, exactly. You know, especially, you know, deciding whether or not to have the surgery, there are a lot of issues, not just, you know, the physical aspect of it, but also how is this going to impact me emotionally in my relationships with other people. So there's a lot to talk about.
Angelina Jolie has started a big and important national discussion. Thank you very kindly. Laura Rebek, oncology genetics risk counselor at Columbia St. Mary. Thanks a lot for being with us.
Thank you very much, Laura. Excellent.